Hi, thanks for tuning into the Natural Dog Mum podcast. I'm your host, Sherry, also known as Bear's Mum and top dog at Bear and Kind Apothecary. In this week's episode, we're talking to our friend Lydia Scarpari from Organix Canine Wellness Centre, and she's going to be talking about things that you can do from the point of view of a myotherapy expert to monitor and to recognise warning signs for potential cruciate ligament injuries. Stay tuned. Hi, mums. It's Sherry. We're back with the Natural Dog Mum podcast. And today we are having a chat with our friend Lydia. Now, she is owner of Organix Canine Wellness Centre in suburban Melbourne. Now, Miss Lydia started out as a natural groomer. She uses completely organic products in her salon and gentle handling techniques, which is terrific. But she's also an eager student of naturopathy and has recently become qualified in myotherapy as well as canine nutrition, well, almost canine nutrition. She's doing some really fantastic work and some amazing things to support dog mums with all sorts of different issues. So welcome.
Hello, everyone. Thanks, Sherry, for having me. Very excited to be on a podcast.
My pleasure. Now, today we were having a little discussion off camera and we were thinking it might be interesting for pet parents out there to learn a little bit more about some things that they can do when it comes to preventing physical injuries later on in life. So tell us a little bit about that.
Yes. Yeah. So I've been practicing for, I think this is year 3 for me. And before I even started my therapy, the reason why I got into it was actually because I noticed a lot of my grooming clients were having mobility issues. And now I've been grooming for over 10 years. And when I started, most dogs with mobility issues were elderly dogs or dogs that had surgery of some sort. And then as the years went on, the dogs were becoming younger and younger and younger. And I feel like, in my opinion, I've found the 2 biggest areas where dog owners are going wrong through no fault of their own, just accidentally allowing behaviors that lead to compensatory muscle patterns, incorrect muscle patterning, and therefore injury. Eventually injury. So little dogs and big dogs are both equally prone to cruciate ligament injuries of some sort or knee injuries of some sort. And if you think about both dogs, in a lot of ways they're completely different. A very big dog to a very little dog. We all know that a very big dog makes sense because they're heavier, they've got bigger bones, there's more pressure on their body, so that makes sense. But then you think, oh, well, why would a little dog have issues? Because they're a lot lighter, they're a lot smaller, and there's not as much pressure on their joints. So I think it comes down to these 2 things. One is pulling on the leash, whether that's a flat collar, a harness, a halter, any walking device. And I call it kangaroo bouncing. I don't know if there's a better technical term. But you know when you come home and your dog's really excited, and again, usually it's a little dog, can be big dogs, and they come running to the door and then they're jumping up on their back legs and they're, jumping up to greet you and they're all excited. That behavior. So I call that kangaroo bouncing. Yeah.
So what sort of things would you do? Say, for example, an owner comes in and presents with, say, a smaller dog who may have been exhibiting these behaviours for a long time. They're getting close to the point of injury, or are there things that you can do at that point to support them?
As soon as you notice it, as long as there isn't already a rupture, which, to be fair, you can manage cruciate ligament ruptures conservatively. Doesn't always work, but it's something that you can give it a shot as long as the dog's not in pain. Assuming that the vet hasn't seen the dog and it's not at the point where the vet thinks that it needs surgery, but I can see that that is the problem. The number one thing to do is to stop it, of course. So stop the jumping up, stop the pulling on the leash. And that might mean working with a dog trainer if the owner's not capable, but sometimes we try one method and it doesn't work. And dog trainers often have lots of different ways of achieving the same goal. So they might just need a little bit of support from someone who can help troubleshoot.
Yeah, or even
the
recommend
problem.
different walking
So number
equipment to
one,
use.
yes and no. I have a thing with walking equipment. So the tool doesn't teach the dog to walk, but some tools are better accepted by the dog. So for example, we all know harnesses are used for pulling. That was their primary design. They make it quite comfortable for the dog to pull. That doesn't mean that a dog wearing a harness is definitely going to pull, but it does make it easier for them. And a lot of owners are less likely to be concerned if the dog is pulling. They're more likely to just kind of go with it. So I think if you've got maybe a big, strong dog, you may need a tool that has more connection to the dog so the dog can feel the pressure a little bit more. And that could be a halter, or it could be a slip lead, or something like that gives you a little bit more control. And sometimes dogs walk better on harnesses as well. They might move from a flat collar to a harness, or they might just move to a flat collar. Sometimes they need a check chain. It just, whatever allows the dog to feel the owner's intention more sensitively, if that makes sense. It's just whatever works for the dog to get the dog walking
In the right way.
as they should, because in the long term, it's better.
Absolutely.
Yeah.
And depending obviously on the particular dog and what's happening, can you give some examples of the sorts of techniques you would use during a consult to assist them?
Yeah, so first we would assess what is happening. So a dog that does both of those actions, funnily enough, presents with the same body type. So I like to call it frog legs because I have lots of weird ways of naming things. We've got kangaroo bouncing and now I've got frog legs. So exactly. So if you were looking at your dog's butt, because that's what we do, you're looking at the back of your dog and they'll have their knees turned out and their hocks, so the back of the leg, turned in. So they'll literally look like a frog in their stance, also called cow-hocked. So they'll present with that. And that's because when they're jumping, their legs do need to turn out. But the problem with that excessive movement is that even when the dog is not doing that, the muscles are conditioned into that position and that puts pressure on the knee, which of course we don't want. So the first thing we'll do is have a look at the conformation of the dog, and that already gives us some good signaling into where the problem is. As soon as I see that, my first question is, does your dog pull on the leash? Does your dog jump up a lot? Do they jump on and off the couch a lot? Are they in and out of the car a lot? Is there anywhere where they're jumping? Because that's what it leads to. And then in-house would be to massage the areas, because the reason why that turnout happens is because the muscles on the inside of the leg are shortening and the muscles on the outside of the leg are lengthening. So they're changing tension as to where they should be, and then they get stuck in that spot. So we need to relieve the tension of wherever is tight, otherwise they can't recover from it. So the owner needs to stop the behavior as best as they can, because anything that happens for the majority of the dog's time is what they're going to be stuck with. So if I can massage the dog and the dog allows me to do, say, a 30-minute proper hands-on massage, that's great. But if the whole rest of the week the dog is jumping and pulling, it's not really going to do anything. I'm going to relieve pain for that session, and then that's it. So it's really, for those behaviors, it is really, really imperative that the owner is on board and can help stop those behaviors as well. And then I would give exercises for them to do at home to strengthen whatever areas need to be strengthened for that particular dog.
Excellent. So you've also got a little studio set up specifically for movement and exercise sessions, haven't you?
Correct. Yeah. So we've got one of the main exercises that we do is, some people might know it as cavaletti, which is usually done with horses to retrain their gait patterns. If you're looking for like a pretty show pony gait, agility dogs and performance dogs, they'll often use the cavaletti poles for that as well, except all of the exercises we do here are really boring. If you compare it to all the exciting things you might see on Instagram where the dog's walking backwards up a wall, or they're on a balance cushion and they've got one leg here and one leg over there, and it looks all very, very impressive, and it is impressive if you can get a dog to do that. However, it's not really necessary for rehabilitation, and it's often very difficult for owners to teach their dogs to do it. And if the dog does it wrong and you keep practicing it wrong, it can cause a lot more problems as well. So my version of cavaletti is to have the dog walking as slowly as possible. And the reason why the dog walks slowly is because it's the only pattern where 3 legs are on the floor and 1 leg's up. So it's a very good balance technique. It works the core a lot more than a trot. A trot is a very efficient movement. Dogs use trot to get from A to B as quickly as possible, expending as little energy as possible. As we're walking, they really have to think about it, funnily enough, and their muscle patterning, everything has to fire at the right time so that they don't fall over. As we're a trot, it's a lot easier for the dog to not pay attention, skip over movements, and still get from A to B. So everything is done.
Yeah, so you can get that foundation right before they start looking at increasing speed or difficulty.
Yeah, more so difficulty. Speed will typically stay at a walk because we're looking at strengthening, not retraining the gait patterns. So we're just looking for the strengthening aspect, but definitely they would get more difficult. You can do lots of different things with the cavaletti poles. You can make quite impressive obstacle courses once a dog is conditioned to the exercises, and you can get quite technical with them. So I typically like to stick with different variations of that exercise that would then be tailored to the individual dog, what we're trying to work on. And then the other thing that a lot of dogs tend to need work on is their glute muscles. And so I recommend owners find a hill somewhere. Usually playgrounds have some kind of hill, you know, like the ones that are made out of the recycled rubber tires and it's all like wavy. Have you seen that?
Yeah.
So I'll recommend owners find something like that and just walk their dog up and down and sideways all along them, because walking uphill works the glutes and the back of the legs. So yeah, there's things they can do not here as well that would help.
Interesting. So what are some of the most common early symptoms that owners report or that owners should be looking for that shows that there is an issue?
So I think, unfortunately for our dogs, a lot of the early symptoms are quite hard for owners to pick up on. And I say that as someone who, before learning myotherapy, also would not have picked up on these things.
So they're quite subtle
and
signs.
It's only now that well, they're actually not subtle. They're just things that you wouldn't think of. So one of the things is hesitating before a jump. So if you're asking, so it's quite big for a dog to, do the whole, I'm not quite sure, and then jump. Quite a big sign, but you wouldn't really think of it. You might just think,
there could be a lot of reasons for that.
I don't know, the dog's being, there could be something in the way. If they're jumping into the boot, maybe there's something in the way for them. Or, I don't know, is there a problem with the dog's eyesight and their depth perception is a little bit off? There's obviously lots of things that it could be, but one of the things is weakness. So the dog's not confident in its ability to make the jump. So that can be an early sign that something's not right. Another thing is reluctance to get up. So, very common in an older dog.
Yeah, of course.
But if your young dog is, if your younger dog is struggling to get up from laying down, that can also be a sign. It'd be easier if your dog's got short hair. But if you can see that their back legs used to be, nice and round, and now they've got like an indentation in the back legs, that's muscle wastage. So a sign that the muscle's not functioning as it should, and that'll be a decrease in strength as well. Some other signs could be licking an area. That's always an indication of, not always, but often an indication of pain somewhere. So if a dog's constantly licking at an area, you always want to check what is at that area: skin infection, bug bite, sore leg. Yeah, so I would say they're probably the most common things that an owner might notice, other than actually watching the dog walk and being to pick up on what's normal and what's abnormal, of course. Yeah.
Interesting. So if anyone is noticing these things or simply wants to get some advice, how can they contact you?
Head to my website. I've got Instagram. I've got Facebook.
Do you want to mention them quickly so that people know how to find you?
Yeah, so on social media, it's organix.dog, organix with an X, and my website is caninewellness.com.au.
Excellent, excellent. Thank you so much for coming on. It was lovely to chat to you, and my brain is already buzzing with so many things that I would like to ask you again about next time. So
Yeah, awesome.
yeah, I think that it's information that is super important and useful for pet parents everywhere. I know, particularly in Melbourne, so many pet parents spend absolutely thousands on cruciate ligament surgery. So anything that they can do to keep an eye out or maybe even prevent these sorts of situations from happening before it requires surgery is an absolute bonus to the back balance and, of course, to the health and well-being of the dog. So thank you so much.
Yeah, absolutely. You're welcome. Thank you for having me. And I look forward to coming back and chatting more.
Thanks for tuning in for the podcast. If you enjoyed this episode, please remember to like, subscribe and share. Say hi to your dog for me.